Hey there. Today, I just want to chat a little bit about what neurological chiropractic is. I think this is something that chiropractors like to throw around, and I just want to clear the air and talk about how we do it in our office here at Early Beginnings Chiropractic. So, when you come in for your new patient exam, we start by sitting down with you and getting a complete history so we have an understanding of where you're coming from, what you've tried already, what your goals are for care. Specifically for young children and babies, we want to know in detail about uh, baby's birth story so that we have an idea of maybe where things started, how long this has been going on, so that we can find the root cause of the current concerns that you're having for your baby or your young child. And sometimes we even talk about this with older children too, especially if they have more of a neurological complaint, whether that's seizures or ADHD, autism, any of those things. We really want to know about the birth process because that plays a huge role into how your child's nervous system is functioning. Then we do an insight scan. Now, this is really cool because this is a really deep look into your nervous system, your child's nervous system, and it uses three parts. We start with heart rate variability, and this is going to tell us about how the nervous system is responding to stress. We're going to find out, are you in fight or flight, or are you tending towards a rest and digest state of the nervous system? Then we're going to check your thermal. And this is measuring the temperature of the skin on either side of the spine, from the bottom of the spine to the top. And this tells us about how your brain is talking to your body in different areas. And it's going to tell us about how long a problem has been there as well. Last, we do surface EMG. There's a fly in here, sorry. Surface EMG is going to measure muscle activation of the tiny little postural muscles next to the spine. And it usually in adults and even older kids shows us areas of pain, but also it tells us about the type of information that your child's brain is receiving from their body. So we want to make sure they're getting good information to their brain. So that they can put good information out. So this is really important on how the brain processes things. So we'll see an EMG that's out of whack with sensory processing disorders, ADHD, and behavioral problems. After your scan, we do an additional exam that we're going to check posture. We're going to check some other neurological indicators to see how the brain is functioning. We're looking for balance. We're looking for, is one side of the brain stronger than the other? How vision is, those sorts of things. We'll also check in on range of motion, and neck, low back, kind of depending on what your main concern is. And then we use all of these things together, the insight scan, your exam, your posture, your history. We build a personalized care plan for you. So what this means is we take a day and look at it all together, consider everything that's going on, and build a plan that we know is going to get you the results that you need for you, for yourself, for your child, for your family, so that you see results and you see them as fast as possible. At your next appointment, we go over these with you, explain the scans, we explain the exam findings, we look at your posture, we talk about the schedule of care, what adjustments look like, so you know what to expect and have an understanding of what's going on in your child's nervous system and how we're going to fix that. When it comes to adjustments, really what we're doing for the majority of the adjustment is assessing the nervous system through the window of the spine so that we can find the area that needs a specific adjustment to make the most impact for your child's nervous system. So the adjustment itself is pretty quick. It's the assessment that takes some time, and it's going to be a little bit different every time. The advantage of having myself and Dr. Steph in the office is that you have two sets of eyes on your nervous system, on your child's nervous system. This ensures that we're going to get to the root of everything. We're going to find everything. It's a huge advantage for our practice members to have this two doctor approach because we can collaborate together. we can talk about what's going on and have two points of view and two sets of eyes that will really support your family through the process. Throughout the care plan, we do check in every 12 visits. So it's going to be about once a month on the scan. So we're going to redo the scan, make sure we're seeing the changes we expect to see. We want to see improvements. Sometimes things look a little worse before they look better, and that's totally fine. It's kind of like when you're cleaning out a junk drawer, right? You pull everything out, it gets all on the table, everything looks terrible. But once everything's cleaned up and organized and put back together, that's when you see the results. So while the scan might look worse, usually we see in that first month improvements in sleep, improvements in digestion, better concentration, and even improvements in that main concern that you have for your child. With the re-exam, we're going to go over those with you too at the next appointment, cover everything, make sure you understand what changes we're seeing. And it gives us an opportunity to, like, is there anything else you need to work on? Are things not going as planned? Do we need to change the care plan? Or are things on track as we expect them? Which is 98% of the time, things are on track as we expect them to be. So that's how we approach neurological chiropractic care here at Early Beginnings. I would love to hear if you have any questions or any experiences with neurological chiropractic care and how it differs from a typical like adult practice, I guess. So leave me a comment below and let me know your thoughts. I'd love to hear from you, and I'll be checking back to see if you have any questions.